I will now examine my patient's nose. I'm first inspecting the outside of the nose, looking for any scars, lesions, or any deformities, and I don't find any abnormalities in her outer nose. For the inside of the nose, I will use my otoscope with the same tip that I used for the ears. Make sure to always go in that order for the examination, inspecting the ear first and then the nose. Okay. I will ask my patient to tilt her head back and I'll stabilize her forehead. And I will gently place the speculum onto the base of the nostril. I'm examining to see if the nasal mucosa is moist and if the nasal septum is intact and checking for any bogginess of the turbinates, and they all appear normal. And I will do the same for the other nostril. And you can also hold the otoscope this way as well, whichever you feel like you can better visualize inside the nose. If the patient does present with nasal obstruction, you also want to assess each nostril. I will first assess the left nostril by pressing down and asking my patient to take a deep breath in and out. And I will repeat for the other nostril. Take a deep breath in and out. And this is only if the patient presents with any signs of nasal obstruction. I will now assess the frontal and maxillary sinuses of my patient. I'll first palpate the frontal sinuses and ask my patient if she feels any tenderness. No. Okay, there's no tenderness. And also the maxillary sinuses as well. Is there any tenderness?
No.
Okay, so there is no tenderness in either of the sinuses. I will also percuss the sinuses, starting off with the frontal sinus, and I'm percussing directly onto the sinus. And the purpose of the percussion is to loosen up any mucus that may be located inside of the sinuses.